Hey everyone, I'm here live with you guys. Let me just connect all our softwares here. We're live on YouTube, live on Facebook, and now live on Instagram. Just hit the button. There's a delay for the Instagram. What's up, guys? We're going to be talking about supplements for knee arthritis today. I see people joining in little by little. We have a couple of people already leaving comments. Dr. House is on here saying hello. Hello to you as well. And then, we got a new member, Poonam. Thank you for joining us on YouTube. I appreciate it, for joining the YouTube membership. We got some content coming out for them. Comments have been insane. Those of you guys that are asking comments, if you're asking a question on a comment, it has become the most challenging ever to see all the comments. And I used to answer as many as I can. I still get in there and answer them whenever I can. I have teammates answering as well as best as possible, but it is a bit challenging with all the comments. So thank you guys for being on there in the comments, showing your support and all that stuff. But my best advice to you is come on to a live with me, and if you can catch me here, I'll answer your question. We're working to get back to comments. It's been tough, but thank you guys. We're going to be talking about supplements that can help you out with knee arthritis. So I'm going to get to that. I have a list here already going. In fact, we're going to cover 11 supplements. And this is an interesting topic for a lot of people because I get this question all the time. What supplements should I take? And before I keep going into the rest of the video, I need to give you the disclaimer that I'm not a medicine doctor. I'm not a MD. I'm a doctor of physical therapy, and I have specialist training that takes me well into the the surgery prevention stuff, like anti-surgery is what I like to say sometimes. I'm not anti-surgery either. I think there's some situations where surgery is necessary, but there's a lot of situations where you can avoid surgery, especially for like knee arthritis. You can avoid having a knee replacement surgery. You can avoid having other kinds of procedures done by fixing certain problems that I talk a lot about on this channel. But I wanted to take a moment to talk about those supplements and give you my perspective on them. Again, I'm not a specialist in them, but there are a few supplements that I've seen people have some success with. So I'm going to go into detail with these here. Who else is here? Kimberly's here as usual. Hi, Kimberly. She says, hi, Dr. David. We have Stavros. I'm so sorry. Hello from Greece. We have the word be true. Amen. Hello. Does backstrap molasses help? I haven't heard of that one. Backstrap molasses. There's always strange ones out there that are just not common. Kay says nutrition too. Who else is here? Katarina says hello from Northern Ireland. Oh, fantastic. I've always wanted to visit that place. I'm jealous that you live there. And then 5 Linwood says hello. Thank you for helping us. Oh, you guys can all hear me, by the way, right? I'm assuming you can. I got my mic on. Just if somebody can give me some feedback and say I hear you coming through. Who else is here? Mrs. N.L. Willie says hi from Ohio. Oh, fantastic place. I've been to Columbus and Cleveland. Both were amazing to see. Alethea says, hello, everyone. Fantastic. Beverly says, hello from Philadelphia. Thank you for visiting us here, Beverly. And then here's Alethea. She says, I can hear you. Fantastic. That's the feedback I needed. Beverly says, I can hear you as well. I got a few more that say I can hear you. Gary says it. And Mrs. Cincinnati is best. I've yet to visit Cincinnati. One day I'll get out there. All right, guys, let's get into the supplements here. So I'm going to show, I'm going to be looking at my screen here for a list because I don't want to forget any of these supplements for you guys. I don't have them in a particular order either, but let me just start talking about the first one here. So the first one is omega-3 fish oil. So I'm going to write omega-3 fish oil. And here's the thing with this supplement. It is an essential fat that our body needs. What that means is that we don't produce it ourselves. We can't make omega-3 fats. So we need to get them from our diet. That's why you need to eat certain things. That's why you need certain nutrients in your body, because your body can't make them on your own with other foods that you eat. And omega-3 fish oil, a lot of people ask, why fish oil? Can I just eat fish? And yeah, you can eat fish, but not everybody likes fish. So you might need a supplement with fish oil. And for those of you that have never taken it, it doesn't taste like fish oil. My recommendation is you get the capsules, because you just swallow it. They do sell it in a liquid form where you can pour it out into a spoon. That does taste fishy. They'll usually put a lemon flavor in it, and if you don't mind the fish and the lemon, then actually is okay. The capsules that you swallow, the gel, usually if you take it with food, it's not too bad. But if you have it by itself and some time passes and you start to digest it and you burp, you might taste a little bit of fish oil. I've never had it be very strong personally. I've never heard other people complain of it a lot either, but I have tasted it. So just letting you know in case you don't know what to expect with the fish oil. Then the fish make this oil in their fat. So when fish have fat in them, and that's how the fish oil is made. It's processed, and they'll distill out the oil, and that's how they make it into the fish oil capsules. The way this is meaningful for knee arthritis is that it's an anti-inflammatory, meaning that when it goes into our body, the fish oil, the omega-3, it connects itself to bad stuff in our body, usually waste products, or sometimes it's things that we consume. And these waste products can, if they hang around, they're oxidants, which means that they can break down tissues. So they break down the cell linings usually, and that's not good for your body cells. So you need antioxidants, anti-inflammatories. They're kind of used synonymously, but they're not exactly the same. But fish oil is one of those, and it'll attach itself to this waste product and take it out of your body. So that's a good thing, right? Especially if you have an active inflammation problem inside your knee joint. So that's how it might be beneficial as a knee arthritis supplement. Let's talk about the second one. Let's change colors here. Vitamin C. Super common one because everybody talks about this as being found in citrus fruits, which is true. So your oranges, lemons, limes, those kinds of fruits will have them. Other vegetables and fruits have vitamin C. It's actually pretty easy to find, as long as you're eating fruits and vegetables. That's where it's typically found. But supplementing with it might be necessary if you're not the type of person that eats a lot of fruits and vegetables. So consider that. Now, I take vitamin C and fish oil myself, and I do eat vegetables every single day and fruits probably a few times a week. And that's just the way that I've managed my diet. But I would recommend you supplement with it if you have knee arthritis, because it doesn't hurt, and it's beneficial in so many other ways. It's great for your immune system. It helps fight off sicknesses. Some people will take they sell Emergency, which is like a little powder pack that you can rip open and pour it into water, like a bottle of water or a glass of water. You stir it in, and it makes this sweet drink, but it's heavy in vitamin C. They sell vitamin C tablets that you can chew and have like an orange flavor to them as well. Or you can just buy it in supplement tabs that you just swallow. All of those work to increase your vitamin C. Anti-inflammatory, like I said, so like the omega-3 fish oil, it can help you with inflammation. All right, next one is going to be vitamin D. I'm just going to abbreviate here. Vitamin D is really interesting because we do make this one in our body with the use of sunlight. So when the sun hits our skin, we release I forgot the name. I think it's beta carotene. And then the sunlight hits our skin and it gets converted to vitamin D. And then your body reabsorbs it. And vitamin D is used for a lot of different functions in your body, especially muscle and bone health, which is going to directly impact arthritis. So it's important to have enough vitamin D. And here's the thing is, even though we can make it ourselves, we need sunlight, and not all of us get into the sun. Some of you guys live in the sun. I am a little brown. I spend a lot of time in the sun. I love being in the sun, actually. But some people don't. Some people burn very easily. Some people don't live in parts of the world where it's very sunny. I'm in El Paso, Texas. I'm in the desert. It's very, very sunny here all the time. And so you have to consider what works best for you. I personally don't supplement with vitamin D because I get plenty of it. You also have to think about the amount of exposure you have. Like even if you are out in the sun a lot, but if you're covered up, it's not the same as if you're uncovered. Like if you're in a swimsuit, for instance, that might be better. So like I'll go outside and exercise sometimes in the sun, no shirt, to get more vitamin D and to help me out with with that process. But if that's not you, if you can't do that for whatever reason, supplementing might be a better option so that you can get enough vitamin D to help your bones and your muscles. It's also an anti-inflammatory, so it can reduce inflammation inside the joints. So it's a good one to try out. I'll tell you more at the end of my list here about how much to take. I'm going to give you some guidelines, not specifics, but just some guidelines. All right, next one is spirulina. Spirulina is really interesting because it is a superfood. It's a blue-green algae. So it's what is it? A phytoplankton is another name for it. It's basically like a plant. Some people call it a bacteria. It's kind of an in-between a plant and an animal, plant and a bacteria. But it is packed with so many other vitamins. So it's kind of like a natural multivitamin. And it goes back thousands of years. Mayans used to discover that it was beneficial for your health. But what they found in it, I'm going to list it off to you. It has vitamin A, vitamin B1, B2, vitamin B5, B6, B9, vitamin B12. It has vitamin C, D, and E in it. It has some vitamin K in it. It even has calcium, copper, iron, magnesium. It has zinc, sodium, potassium, phosphorus, and manganese. It has a lot. It's like taking a Centrum vitamin. It is an antioxidant and an anti-inflammatory. So it's kind of a one-stop shop when it comes to taking all those. Now, the amounts of it are going to be smaller relative to taking like a full-on iron supplement or a magnesium supplement. So you have to take that into consideration as well. The next one is quercetin. I might have misspelled it. But quercetin is an interesting one. It's found in fruits and vegetables often. Capers are especially high in quercetin. It is an anti-inflammatory. It's actually commonly used as an allergy supplement. So like if you have a lot of allergies or you live in a part of the world where there's high allergies, you might take quercetin. But because of its antioxidant, anti-inflammatory components, could be beneficial for knee arthritis. The next one is turmeric. And along with it, I'm going to put the other one with it, curcumin. These are frequently found together. For example, you might find the supplement bottle. Do I have any here? I've got a few supplements here. Like here's spirulina. Here's our omega-3 fish oil. Got a bunch of supplements. Oh, here's my turmeric. And here's quercetin. Look at that. And this quercetin comes with ester C. So it's like a vitamin C. So it's quercetin and vitamin C together. So I'm listing all these out kind of individually, but you might find out there in the market if you get a supplement that they're combined. Here's vitamin C by itself. I got one more here. I didn't have this one on the list actually, but this could be helpful as well. I'll add it in before we're done today. So quercetin, I was on that one. Quercetin is, oh, I'm sorry, I was moving on to turmeric. Let's go to turmeric. Turmeric and curcumin. So turmeric is a yellow spice, and curcumin is actually made from turmeric. So it's kind of a derivative of the other one. And curcumin, it sounds kind of like curry, right? Curcumin. It's because it is curry. It's what makes up curry. Curry is an Indian spice. It's like commonly found in Indian foods and other nationalities as well, delicious foods. But this is found to be an antioxidant and anti-inflammatory as well. Now, if you take this stuff, it doesn't taste, you can't really taste it because these are capsules, so you just swallow it. I've never tasted it in the aftertaste before, but this can definitely help out with anti-inflammatory reasons. So it says right there, inflammation supports healthy inflammation response. So this might be one that you try out as well, along with curcumin. They're often found together. Sometimes you can find them apart. What do we got next? Almost done with the list here. Let's go to, it's kind of a newer one, hyaluronic acid. Hyaluronic acid is a substance or a molecule that's found within cartilage and the joint fluid, which is called the synovial fluid. But inside your knee joint, there's liquid joint fluid, and that fluid is made up of a bunch of different things, one of those being hyaluronic acid. So you might supplement with hyaluronic acid if you want to improve the health of the cartilage as well as the joint fluid, because you need that. And commonly, you'll find hyaluronic acid with a few other ingredients. Let me write those in for you. Those are going to be your MSM, and then glucosamine, and then you have chondroitins. Oops. Chondroitin. Sorry, my spelling gets worse as I have to slouch more. So these come all together in this supplement, and I'm holding, just a side note here, I'm holding common looking bottles because they're the same brand. They're Solgar brand. I like this brand particularly because they go the extra mile. They have glass amber bottles, kind of like the same as a beer bottle. They do that because it blocks light from coming in, which can break down the supplements. So it's protective of the supplements. And then the glass is good because it doesn't leach like plastics do. So bottles like this are, they're potentially cutting corners because they're using glass bottles. And then oftentimes these supplements are like this one. This one considers allergies a lot. I don't know if you could read that, but it says non-GMO, GMOs, genetically modified organisms, gluten, wheat, and dairy-free. So for people that have a lot of allergies, which can be a concern for all of these supplements because of how they're derived, because some of them sometimes are made from shellfish, or they have some dairy component or some gluten component, and you might have a reaction to them. And overall, the vitamin D or C or any of these other ones might be good for you, but the capsule they're using might have some shellfish component or something like that, or they'll mix it in with other components to make it like that chalky tablet, and that could set off an allergic reaction. So you have to just watch out with that as well. But anyways, going back to glucosamine, hyaluronic acid, and chondroitin and MSM, this stuff is like the ultimate joint combination. It's like the cocktail that you would need for maximum joint health. This is directly replacing, or replenishing is probably the better word, the fluids and the components inside your knee joint. All of these things, glucosamine, chondroitin, MSM, and hyaluronic acid, are components that make up cartilage and connective tissue, which, like, there's other things that make up connective bone, tendons, ligaments, parts of your skin. All of it has connective tissue, but specifically we're worried about cartilage and then the fluid inside the joint. This helps directly with all that. And then there was one more that I had. I think it was this one. Here we are. Calcium, this is a bonus. Calcium, magnesium, and boron. It says here, promotes bone health, supports nerve and muscle function. I don't know, but I think for the way that I talk about fixing knee arthritis by addressing the root problem, which is a muscle imbalance, you need good muscle and nerve function, because your nerves have to connect to your muscles to tell them what to do. A lot of people forget how important that is. You just move and not think about it, but you need to have conscious control, which means the nerve pathway has to work well. So this combination, calcium, magnesium, and boron, can help tremendously for making sure that you have the optimal healing environment for the entire system. All right, guys, so there you go. Let me write down the last ones too, just so that we have them on here on the list for you guys. So the bonus ones, I'll write them in red. How about that? So we had 12 calcium, 13 magnesium, and 14 was boron. All right, so there's your list. Here's some guidelines. I don't think you need to take all of them at once. I think what's more important is that you pick 2 or 3, pick a few, because that'll be easier in your wallet, but it'll also be easier for you to judge whether or not it's successful for you. So if you pick 2 or 3 and try them out, and like a good one would be these 3 right here. I'm sorry, these 4, because they all come together. You can easily find glucosamine and chondroitin together, but they're starting to make combinations with both of these MSM and hyaluronic acid together. Try them out and take the whole bottle. You have to pretty much take it for 1 to 2 months. So you have to look at the serving sizes, the dosage, read the label on all the vitamins that you're taking, and see how much you should be taking. You might Google how much to take exactly. Usually the label will tell you what you need to take based on the amount within the supplement, like the milligrams of whatever component you're taking. So look at that and then plan how many bottles do I need. Do I just need 1? Will that last me 2 months, or do I need 2? Depending on if I have to take 1 or 2 tablets or more. And then see how you feel off of that. But you also need to know that it's not just these supplements that are going to fix your problem. Very important. Let me draw this picture for you here. So let's say this is your knee arthritis problem, okay? I'm going to say knee, and then I'm going to say arthritis problem. If 100% of your problem can be split up into factors, this is what I typically see. About 3/4 of it, we'll say 75%, tends to be a muscle imbalance. Then over here, we have a diet problem, which nutrition can be involved with this. And then over here, we have a weight problem. I'm just going to write WT. And we'll say this is 25%. Follow me on here, because this is important. A lot of people, this is what gets a lot of people stuck doing the wrong thing. Assuming that you're not super overweight, and it's a range, it's usually a percentage of your body weight. You can calculate this in many different ways, but what I found is I tell people, if you're not more than 50 to 100 pounds overweight, the reason for the range is because if you're a smaller person, 50 pounds is plenty. 100 pounds is a lot of weight. But if you're a taller person, then 50 pounds might not be that much relative to you. So you have to figure out what it is. But most of the time, if you have a little bit of weight to lose, it's not that big of a deal, because the majority of your problem is a muscle imbalance, not weight. And then there are some people out there that are very thin. They actually don't have a lot of body fat to lose. So I would shrink this down to nothing or next to nothing. They really don't have to worry about weight. But a lot of medical professionals will tell patients with knee arthritis they need to lose weight. And if you just have 10 or 20 pounds to lose, it's not that big of a deal. I would make this way smaller than what it is right here, even on this picture. Now, diet and nutrition is another factor, because that's the foods that you're eating. Because maybe your weight's okay, it's not a big problem, but if you're eating very unhealthy foods, the ratio of healthy to unhealthy foods is off, and it's a lot of unhealthy and not that much healthy foods, there might be inflammation that's occurring inside your body that's setting up your knee osteoarthritis, your pain in your knee joints right now. So you might need to modify your diet despite your weight and despite the imbalance. That could make an improvement there. But look at the size that I've drawn it here on this pie chart. Most of the time, though, what I've seen is in people that I don't tell them to change their diet and I don't tell them to lose weight. There are some cases, but for the most part, most people I am telling, don't mess with this. Focus on this part, the muscle imbalance part, because this gets neglected so much. The surgeons, the physicians, they're not thinking about this. They're focused on this right here and then giving you medications to help with the pain, but that's all short term. But if we can fix the muscle imbalance, meaning the balance between the muscles in the front of the thigh and the back of the hip, because that's the main imbalance that sets up knee arthritis. If your quads on the front of your thigh, these muscles right here are too dominant, too strong, they compress the knee joints. And these muscles get too dominant and strong because these muscles back here aren't doing their job. They're not strong enough. And so quads like to take over for weak glutes. Then that sets up too much pressure, and that's the muscle imbalance. But you can fix that without losing weight or without changing your diet. And if you focus on that, you can have a massive improvement. So all of these vitamins and supplements that I'm telling you about right here, they're only going to make a relatively small improvement in your knee arthritis. That's why I'm telling you, you don't need to focus on these as much as you probably need to focus on this. But if you're watching right now and you know you're obese, you know you got like 50, 100 or more pounds to lose, then this green section right here is going to grow. If you know you haven't eaten a vegetable or a fruit in ages, then this red section is probably going to be a bigger part of your problem. But for most people, they're exercising or they're not exercising. In both scenarios, you can get a big giant muscle imbalance. That's the majority of your problem. And if you can fix that, you're going to help your knee arthritis out tremendously. There's hardly anybody out there in the medical field that talks about this stuff because it's not common knowledge. It's not common practice to tell people strengthen your glutes and stop strengthening your quads because that's messing up your knees. That's creating too much pressure. All right, guys, that's my teaching for today. We're going to answer some questions next. So I'm going to go down my list here and see what y'all got. Give me a minute while I orient myself here. Whew, lots of comments coming through. Let me back up to the top here. Iva's here from Tennessee. Fantastic. Somebody's saying hello from Las Vegas. Laurel is saying they're in Potsdam, New York. Fantastic. Okay, MSM. Yeah, I don't know the molecule pronunciation. It's like methyl sulfol something. It's a mouthful. It's one of those scientific words that even the scientists have a hard time pronouncing. Only like the chemists know how to say it. But MSM is what you'll commonly see it as. Let me get to the bottle here so you can see it's even on the label as, see on the bottom right there in the big text, MSM. Let me see if I can find the name of the component here. Yeah, methyl sulfonyl methane. Methyl sulfonyl methane. That's how you say it. Can you give approximate dosages? It varies, Mrs. NL, Willie. The dosages are going to vary depending on the supplement that you buy. So the brands have different ones. Like this brand is going to have, this is for spirulina. If you buy like the Nature Made one or the Solgar one, they might all have different dosages. So you have to look at the labels on the bottle to see which dosages you need. All right, who's here? In Giski says hello from Slovakia, Europe. Hello. And then Anne is in Australia. Hello, Anne. And then we have Gary JB. The omega-3 fish oil doesn't do anything in my experience. This is a good comment here. Yeah, I listed a bunch out here because everybody's genetically different. Everybody's diets are different. There's so many variables that go into which vitamins you should take. And so it's hard to tell you specifically like, yeah, this one right here or this one right here is the one you need. This really comes down to experimentation on your part to figure out what's best for you. And there's a little bit of strategy you can put into this by thinking about your diet. You know, what do you eat? What don't you eat? Like if you're not eating a lot of fish, you might look at the fish oil because it's more concentrated in fish. And then it's also the type of fish that you're eating, like the fattier fish. So I know that they get it from mackerel, sardine, anchovy, and there's another one. But those are the type of fish that are heavier in omega-3. If you're not eating a lot of fruits, especially the citrus, then vitamin C might be more important for you. If you're not getting a lot of sunlight. So you have to think of it in that way. Think of the strategy behind this. But Gary, you might be healthy in omega-3s already and not need to, you might get it from your diet is what I'm saying. You might not need a supplement in it. And it might be your experience that when you took the supplement, didn't do much for you. And then the other factor, just to complicate it further, is you might overall have a good diet and you working on this slice of the pie just isn't going to move the needle much on your knee arthritis because this might be the bigger factor for you, or this might be the bigger factor for you. It depends on your specific evaluation of your situation, Gary. Good one. The word be true says sardine, salmon for me, and vitamin C and D. Fantastic. Gary B says salmon. Shirley Lindsay says, how much does a person take per day, i.e. recommended vitamin C, 200 milligrams per day? Yeah, so you'll hear different medical people saying things like, you know, if you take too much of a certain vitamin or supplement. Sure, there's risks, which I need to say about that. Like, especially with, which one was it? There was one of these vitamins or supplements. Let me see if I wrote down notes on it. That if you take it with blood thinners, you need to be very careful. Here it is, fish oil. If you take it with blood thinners, you need to be talking to your doctor with all of these, by the way. Like if you, especially if you have another condition, like if you're being seen for a heart condition, a cholesterol problem, diabetes, don't take these willy-nilly. You go talk to your doctor and make sure that you tell them, hey, I'm taking this. Is that okay? Because the doctor's going to have knowledge of, oh, you know what? There's reports of spirulina not working well with this diabetes medication that I have you on. Got to watch out for that. Or this, cholesterol or triglyceride medication or whatever it is, blood thinner. So be very careful to make sure you talk to your doctor and then talk to them about the dosages that you're taking as well. And then surely, like I said, you have to read the bottle and see what's going on. And what I was going to say is some of these doctors will also say, like, if they don't have any concern about there being a conflict with another medication or thing that you're taking, then what you might hear them say is, well, don't take too much because then you're just peeing it out. Because some of these you'll just excrete, you'll get rid of it in your urine. And then they'll say things like, well, you're just peeing your money away. I think that's not the best way to look at it, because I would rather maximize the amount of whatever supplement that I'm taking in my body to the point where my cup is overflowing. It's filled up. I've maxed out on the vitamin C that my body can hold. That means that I am antioxidating as much as possible. And then pee out the remaining vitamin C, than not have enough. I think that's a better situation, but you have to consider what's best for you. All right, we're going to go for about 10 more minutes here, guys. So get your questions in. If you have a burning question, you want to do a super chat on YouTube, I can see it on my software here. I can see Facebook comments as well, but not Instagram comments. All right, Iva says, pushing my mom in a wheelchair and my knees, tibias are out of line. This helped me a lot the first try. I do it every day. The pain comes back by the end of the day, but it is less. Okay, maybe you're talking about a tibial shift correction, because that's when I talk about like the tibia. Hopefully that helped you out, Iva. Fantastic. All right. Asma says, hello from Egypt. Helen, this is glucosa. You must have asked earlier on. Yep, glucosa means right there, number 10. Steve has a total knee replacement in 30 days. I'm so sorry, Steve. Hopefully it works out really, really well. I encourage you to try out our knee arthritis recovery program. The first phase is completely free, and go check out our website to see if it's open for enrollment right now. And I have this on here. This is part of what we talk about with knee arthritis. This is a good point to talk about this. This is the phases that I've developed within the knee arthritis recovery program, phases 1, 2, 3, and 4. And these are the criteria for each of the phases. So depending on where you're at, you can work your way to the right through the phases. So Steve, if you're in a situation where you maybe find yourself like in these phases, you have an excellent chance of making it to phase 4. If you find yourself here now, if you're in phase 1 where things are the worst, you can't walk very much, you're having constant pain, pretty much constant, it's like every day, every other day. Oh, I'm sorry. This says hip stiffness. We're on the knee program. This is the typo. But anyways, it should say knee stiffness. If you have a lot of knee stiffness, then there is potential that you have changes in the joint that need to be replaced, where the joint just needs to be replaced. But very often what I find is that people just have an irritated joint and we need to take pressure off. And if you can do the right treatment to do that and begin to move over to the phases this way, you can avoid the replacement altogether. But you'll have to see your specific situation, Steve, and see if it's best for you. All right. Our believer, Camu vitamin C is vegan and non-ascorbic. Cool. Didn't know about that. There's so many options out there, guys. Like, you have to look and see what works for you. Mrs. NL Willie says, what happens if the cartilage is gone? This is a good one. When they tell you that there's no cartilage. They're usually looking at the x-ray and they're not giving you an accurate picture of what's going on. In fact, it's probably better if I draw it on for you guys. Let me change the page here. Because when it comes to knee arthritis, it's diagnosed through x-ray most of the time. And they'll do an image of the knee. And I'm just going to draw a rough image here. And there's the thigh bone. And then they're looking at the shin bone that comes right under right here. And if the space right here, let me draw it in red, is decreased, then that's when the doctor's going to say something like, oh, you don't have any cartilage left because the space is gone. But they haven't looked inside your knee joint. But in reality, here's a knee. There's a kneecap, thigh bones on top, shin bones on the bottom. This entire surface right here is covered in cartilage. And you might be getting it squashed, and then there's maybe one spot like right there, that size, that is actually damaged cartilage. And so they won't tell you that there's still cartilage there. They'll just tell you it's gone, and they mean one spot is gone. So I would always question that. And the best way that you can tell that you do have a lot of functional cartilage is your motion. If your motion in your hurt knee is like 90% or better compared to your other knee or what you normally would be if you didn't have a knee arthritis problem, in other words, you've only lost like 10% of your knee motion, then that means that your knee joint works. It's just a little bothered right now. It's irritated. Potentially there's one spot that's showing some damage, but you still have a lot of functional cartilage. And if you can get the cartilage to be healthier using all these supplements, and fixing the problem in this light, like looking at the muscle imbalance instead of just the diet and nutrition and the weight, then you have a good shot at offloading that knee joint, getting that last 10% of motion back, and doing a lot better. But the flip side of it, Mrs. NL, is if you have a big loss of motion, especially if it's been there for months, then there's a greater likelihood that you do have some more permanent damage that could need a joint replacement. But very often I've had people come into my office with knee arthritis and they've told me the doctors told them that there's no cartilage left. I don't know if the doctor literally said that, or maybe they misinterpreted, they miscommunicated with the doctor, the doctor miscommunicated with them. And they have that in their head now that there's no cartilage, yet they're walking in, yeah, it hurts and they might be limping, but I'll check their knee motion and it bends pretty good. I'll bend their knee and I'll say, well, it goes straight and then you can bend pretty good. And yeah, there's pain at the end of each of the motions, but if your knee can bend, then great. If there's truly no cartilage though, it's not gonna move very well. It's gonna be all crunchy and cracky. It's gonna ratchet is what we call it, where it goes and it just doesn't bend normally. So be careful with interpretations from doctors. I think they need to get better at explaining what's going on in the knee. Linda Rogers is in Southern California. Fantastic. Maduri says, hello, everyone. LF says, I'm vegan. What's the best substitute for omega-3 fish oil? You're going to have to look that one up. You know, I am not great with vegan substitutes. I am pretty carnivorous. I do eat vegetables, but I haven't looked into that. I'll have to look that up for you. Regina Harris says, what is the name of the supplement brand you're using? Solgar, Solgar. I like this one the best. I found this to just be the highest quality one. But you know, sometimes they don't have everything just the way I like. I've gotten this brand. Here's this brand. Nature Made is another one that I've seen. There's differences in quality. You have to try them out. All right, nearly done, guys. We got a couple more minutes left. Shouldn't you be taking vitamin K with the vitamin D? I'm not sure. I don't know that interaction. Like I said at the beginning, I am not a nutritionist. I'm not a medicine doctor. I am a physical therapist. That would have to be, I would ask your doctor. Omega-3 in form of marine algae. Oh, there you go. Okay, that could be a vegan option. Mrs. NL Willie says, can you help me? 2 osteos, doctors say total knee replacement, TKR. I hope that helps. What I was talking about earlier with the knee. If you have good motion, you might be just fine. Kimberly says that dang muscle imbalance is always a problem. It is. It really is. That is what is right under our noses. You're working on it since you're a kid, and it just keeps creeping up on you as the decades pass. And by the time you get into your 50s and beyond, that's when arthritis starts to develop. But if you can, even if you already have arthritis, if you've been diagnosed with osteoarthritis in your knees, you can offload the joint and be much happier in knee joints. All right. Anarchy Queen 85 says, are these still safe to take if you are on methotrexate for rheumatoid arthritis? You need to talk to your rheumatologist on that one. See, questions like that, I can't answer. You got to talk to your doctor. Babs Coker says, at Kim, I think vitamin D works well with calcium. Be careful making recommendations to each other, guys. You guys got to check with your doctors. And if you're not talking to a doctor, I would recommend you talk to a nutritionist at least. You can easily go find one. There's plenty of nutritionists out there. You just got to look one up, and they usually know interactions as well. But they might also tell you to go work with a doctor too. Halit says, I am from Turkey for new vitamin taking method, right? Okay, we have a solicitation there. Cynthia says, vitamin D and boron really help me. Fantastic. Vitamin K and calcium both give me heart issues. Be careful, please. Oh, she says be careful. Great. The word be true. Vitamin D, C, and turmeric tea also decrease salt and sugar. Yeah, there's all kinds of options out there, guys. My recommendation is just start trying some out. Think of this. This is crucial. I wanted to make sure I drew this for you here. Remember, this red slice right here, you have to consider, do you have enough nutrition in your diet to make this irrelevant? Because then you don't need to worry about the vitamins and supplements as much. You can try them out still, but don't spend your time going down the rabbit hole of which vitamin and supplement combination is best for me, when this is the real problem that you just need to address. And if you make an impact here, that's going to make the biggest impact for your knee health overall. Versus if you find a couple of supplements that kind of help you out, it's rare that it's going to make it go away completely. You usually have to worry about the muscle imbalance. Fix those quads and glutes. All right, guys, it was a pleasure hanging out with you this afternoon. I think we're going to switch to Tuesdays for our live stream. So just in case you're here regularly, Kimberly, put this on your calendar for 2 o'clock on Mountain Time. Sorry, at 3 o'clock on Mountain Time. So you adjust for your time zone, and hopefully we'll see you here. Have a wonderful day, guys. Bye-bye.